Hello, everybody. My name is Ariel Fay Carr. I'm a strength and conditioning specialist here at the McKinley Center. Today, I'm going to add on to Dr. Meehan and Dr. Jackson's previous talk about safely exploring the outdoors, injury prevention, and post-rehab exercises. So the topics that we're going to discuss today are hamstring injuries and ACL injuries, particularly in the water skiing and wakeboarding sports, as well as chronic and overuse injuries in paddleboarding sports. In Dr. Meehan's lecture, he spoke about fractures, strains, and sprains, as well as backpacker's palsy. So we're going to look into that as well. So for our first topic, post-rehab hamstring and ACL injuries. Now, what's really important is to avoid isolating a particular muscle. So we don't want to just isolate that hamstring. Instead, we want to consider how the muscles work in conjunction with the surrounding muscles. So you want to choose exercises that allow our muscles to work as a unit so that we can relate to standing, walking, and running. So when we want to start our post-rehab exercises, we want to focus on bridging variations. So we want to really focus on the co-contraction of the obliques and hamstrings that allow those glutes to act as synergists during hip extension. It also allows us to increase pelvic control. So our first exercise here, we have bridging, just driving through the heels, toes up. Arms are extended just to create more stability. And then from here, you can go to a single leg variation. Now for that single leg variation, I like adding that hand pressure on the opposite knee to allow hip flexor engagement while the opposite glute is engaged. We have slide board curl variation. So once we are good with bridging, we can progress to slide board curls. This exercise really focuses on eccentric loading. So when that weight is coming down on us, we also want to control the movement throughout, and it also helps improve strength to the hamstrings to prevent future injuries. So again, here, toes are up. You want to really press into the heels. The first variation, we're just doing eccentric only. Once they're good with that, you can really add the full motion where the hips are up the entire time. A second variation, again, would be a single leg variation. This one's quite challenging. Make sure that they're only doing the full variation once they're comfortable doing the eccentric only variation, which is right here, where they come down after they eccentrically push out. Our next choice for exercises, once those slide board variations are great and good to go, we want to focus on increasing external load to the musculature by doing some single leg deadlift variations. It also allows us to introduce balance to those muscle groups. So the first variation I usually start with is an assisted single leg deadlift with the cable machine. So from here, using that weight to counterbalance ourselves while we hinge into that movement. Notice that I have a soft bend in my supporting knee and I'm driving that heel back towards the wall behind me, really focusing on feeling the weight being shifted into my heel. So you really want to feel not only your hamstrings, but your glutes as well. The next one would be then going from a standing position, just body weight, again, focusing on the opposite arm and leg, reaching away from each other. My body is getting to right above parallel before I rise up for balance. Our next one here would be then to add a weight to it. So we have here a kettlebell, single leg deadlift. Again, keeping that kettlebell close to the body, making sure I'm feeling that squeeze in my armpit to engage my lat muscles and to maintain proper balance. Finally, we want to progress to our plyometric training. So once we've gone through all those three progressions, we want to now add some intensity to it. So we can start with 2 leg hurdle jumps, linear, so forward, as well as 1 leg hurdle hops, linear, as well as lateral and medial. So here we have a video, just regular 2 leg jumps, making sure proper technique and stability on each landing, really focusing on quality. Here we have medial jumps, so jumping towards the inside, resetting before each jump. And lastly, we have a lateral hop, also focusing on that balance position and landing position on the end. So our next topic, overuse injuries. So Dr. Jackson spoke about overuse injuries being very prominent during paddle sports. So rowing, kayaking, stuff like that. Now for prevention, We have strengthening the musculature involved in those movements, as well as increase and improve range of motion of the joints. Now I got a few exercises here showing different variations. We have a T-spine rotation here, so focusing on upper body mobility and the thoracic spine, really making sure that we are opening up towards the ceiling and having our head follow the movement. Now on that variation, I'm using a block, and you can progress from that exercise by bringing the block lower and then essentially bring yourself down to the ground. Another exercise drill here is cervical rotations in a 90-90 position. So supine, back on the floor, heels elevated to allow for proper pelvic position and flattening of the back. So we want our back to be flat on the ground, and using the ground to press our neck into it. So again, allowing some neural drive into that neck and just creating a bit more range of motion. Our next exercise here, we have shoulder cars from a tall kneeling position. CARS stands for controlled articular rotations. So really focusing on full range of motion in that shoulder. So coming up with that thumb, rotating the hand out, and then continuing that rotation until you come down, and then doing the exact opposite on the way back. Notice in that exercise, I do not use any other joint. I start with that tall kneeling position to really focus on pelvic control, not using any lumbar compensation, and making sure nothing else is moving other than my shoulder. Here are a few drills for shoulder health as well. We have wall facing extension to flexion. And then here we have a 90-90 degree external rotation. So some again is really good to open up that shoulder. So again, really focusing on making sure we have full range of motion in our upper body. And then for strength, a really good way to start is bottom up carries. So notice in that position, he's holding the kettlebells upside down, which creates more instability, which is a lot harder to control, but doesn't demand full range of motion as a press does. So it's a really good starting point for shoulder strength. So a quick point that I want to make too as well when we're speaking about overuse injuries, particularly in sports like this, is to focus on posterior chain exercises. So exercises that really focus on the muscles that are located in the backside of your body. So we got latissimus dorsi, you have your erectors, your glutes, your hamstrings, all those muscle groups, even, our serratus anterior and our obliques are really important to work on. So we have here a single leg and 2-leg ring row variation, as well as different variations for a carry. So a carry is a really good way to work on those muscles without any moving forward and backwards. So it's a really good exercise for all levels, as well as people that are injured in their lower limbs. So we have here a suitcase carry. We have, front rack carries, farmer carries. We have a low high carry, different things also that challenges your shoulders. And then for those ring rows, like I said, 2 to 1 leg, also engaging glutes and hamstrings there. All right, and for rehabilitation, just making sure that we rest and that we avoid activities and movements that incite that pain. So we really want to make sure that we avoid anything that hurts it. So, do no harm. If it hurts, then don't do it. Now, for Dr. Meehan's talk, he spoke about fractures, sprains, and strains. Now, how do you want to prevent those things from happening? Well, it's really important, especially, before going on hikes and walks, that we have proper ankle mobility and stability. So ankle CARs, again, controlled articular rotations, and passive stretching is really important to introduce in your routines. So ankle CARs is just challenging, again, that foot in different angles. So notice I'm holding my leg in a position that isolates every other part of my leg, and I'm only focusing on the ankle. Here we have some ankle dorsiflexion stretches here. Notice I'm using my body weight to help create more pressure. I'm really trying to reach that end range. Lastly, here you can use the wall and just get a nice calf stretch here, rising up and then releasing, coming up and down in that stretch. All right, now how to prevent it. Now, it's really important to strength train eccentrically, especially when we're doing hikes or anything that goes up and down. Now, generally, most people get hurt while they're going down during a hike. So eccentrically, we want to make sure we can come down on our feet, on our body as controlled as possible. So doing split squats, single leg squats, any unilateral exercise, and adding a tempo on the way down is going to be super vital during that exercise. So here we have a split squat. Again, focusing on how slow I'm coming down from that exercise here as well. Slowly sitting back as slow as I can, as controlled as I can. Really important again to control the way down and coming up in one movement. And again, step ups, same thing, coming all the way up and then controlling down. Here, lastly, we have backpacker's palsy. So for post-rehab, it's very similar to the exercises I had just shown during the overuse injury portion, and really focusing on improving range of motion in our joints of upper limbs. It is important to make sure you ask your physician or your physical therapist beforehand, making sure that you are at that point where you can add those things into your workouts. And other exercises for strength that can be done from a supinated position, so on your back, or prone, so your stomach on the ground or facing the ground. And also really important to start maybe with bands. Here are some 2 other drills that I have not shown before, especially that can help improve the range of motion for someone who does suffer from backpacker's palsy. So for shoulder floor slides, if ever you're in a position, again, most people that have backpacker's palsy are very internally rotated. So doing floor slides is going to be very challenging. So a good corrective and a good thing to kind of help create a better position during that exercise will be to add an Eric's pad to create more tension and neural drive into that shoulder. So grabbing a pad, squeezing your fist and actively pushing into that pad 3 to 5 times per side is going to allow you to create more range of motion and get better contact with the floor during those floor slides. And lastly, shoulder cars, but doing them from a prone position is very challenging. It's a much wider end range, a lot more challenging than doing it from a tall kneeling position. So here, keeping that thumb up, rotating at the halfway point, bring the hand back to handcuff, and then coming back to the front. So again, a lot of these exercises are really important, not just for people that are planning on hiking or going for long walks, but just in everyday life and just for health reasons. So hopefully these exercises have been helpful. Hopefully you understand them really well. And please feel free to reach out for any additional questions or concerns about anything I spoke about. Hope you enjoy. Have a great day.